So over the last year, we've been seeing lots of headlines about the rise of artificial intelligence. Some people are worried that it might be dangerous or that it might take away lots of jobs. But it turns out that AI is already part of many people's lives. Roughly 35% of Americans now say they use AI for health tasks, whether that's meal planning, getting workout recommendations, logging their steps, or tracking their sleep, or even getting daily mental wellness checks. This is according to a new Washington Post ABC News poll. And this use of AI for health tasks is pretty evenly split between men and women, and across different age groups. It's also pretty evenly split between people who identify as Democrats and Republicans. And people are using AI for health tasks both with and without a doctor's recommendation. For example, some people are turning to AI apps for mental health support. These can help people cope with anxiety or depression by providing things like mood tracking, cognitive behavioral therapy exercises, and even just a listening ear via an AI chatbot. Other people are using AI to get advice on diet and exercise or to track their progress towards fitness goals. There are also apps that can use AI to analyze a person's sleep patterns and then recommend ways to improve sleep quality. The use of AI for health tasks is not without its critics. Some worry that these apps will overstep their bounds and try to tell people what they should eat, how much they should exercise, or even whether they should keep seeing their therapist. Others worry that these apps will collect too much personal data or that they might not be accurate or reliable. But despite these concerns, more and more people seem to be turning to AI for health advice. So in this episode, we're going to talk about some of the ways that AI is being used for health management and what the research says about its potential benefits and risks. Many people turn to AI for health tasks because it can be a convenient and low-cost way to access information and support. For example, an AI-powered chatbot can provide 24/7 support for people who might not have access to a therapist or counselor during business hours. Or an AI-powered app can offer personalized nutrition and fitness recommendations without the need for a personal trainer or a dietitian. But it is important to remember that AI is only as good as the data it was trained on, and it can perpetuate and even amplify existing biases. For example, if an AI system is trained on data that shows that women are less likely to be hired for leadership positions, it might conclude that women are simply not as qualified for leadership roles. As a result, AI systems can reinforce and even worsen existing inequalities. Another concern is that AI systems can be opaque, meaning that it can be difficult to understand how they make decisions. This can be a problem when it comes to healthcare because people want to know why a certain treatment is recommended or why a certain diagnosis was made. If an AI system is making decisions in a way that is not transparent, it can be hard to build trust and people may be less likely to follow through with the recommended treatment. Despite these concerns, there is also a lot of potential upsides to using AI for health tasks. One study published in the Journal of Medical Internet Research found that an AI-powered chatbot was effective at providing support to people with anxiety. Another study published in the journal JMI Mental Health found that an AI-powered app was effective at helping people with depression manage their symptoms. And a study published in the British Journal of Sports Medicine found that an AI-powered system was effective at helping people increase their physical activity. It is still early days for AI, and we don't yet know all of the potential benefits or risks of using it for health tasks. But one thing is clear: AI is already a big part of many people's lives, and it is likely that its use for health tasks will only grow in the future. What do you think? Have you used AI for health tasks? What has your experience been like? Let us know in the comments below. And thanks for watching.